And I believe in a thing called love. BBC Radio Northampton, Helen Blaby here until 6 o'clock. And over the last few weeks, we've been talking about the problems people are having getting a doctor's appointment. Listeners got in touch to say that Lakeside surgery in Corby was particularly bad. One of them is Carol Matthews, also a patient at the surgery. She told us about the problems she's been having.
I'll give you an instance. I phoned on the 12th of May. I knew I'd got an infection come on. I needed antibiotics. I managed to get through, I think it was at 8:20. No appointments left. If I'd have got those antibiotics when I needed them, I would have been on them for 2 days. Instead of that, I ended up in A&E with breathing difficulties.
Annabelle asked the MP for Corby and East Northamptonshire, Tom Pursglove, what he knew about the issues at the surgery, and he says he's going to look into them.
Well, it was quite interesting. One of the big pieces of feedback that came across on the doorstep during the local elections was this issue of GP access. And I wasn't just finding this in Corby, I was finding this across the constituency, with people just finding real trouble in getting in to see their GP when they feel that they need to see them. Obviously, with the pandemic, there was an element of having to change the way that those sorts of services were provided. But ministers have been really clear that face-to-face appointments have now got to begin happening again. I know that obviously our local GPs are trying to make that happen, but there's clearly a disconnect because I've got too many people emailing me at the moment raising concerns about this, and obviously those conversations I had on the doorstep. So I had some real concerns on the back of that, and I'm keen to do a piece of work to try and get to the bottom of exactly what's happened, what's going wrong, and trying to find some solutions so we can fix it.
Well, Dr Kalindra Tumaragotti is from the British Medical Association. Good afternoon.
Good afternoon, Helen.
Is it unusual to have this much of a problem?
We are seeing, as you might have seen an article, I think, last week, we're seeing at the moment a tsunami of workload and increasing demand lately in GP land.
Why?
There are many factors for that. If you look at it, all GP practices have continued to see patients in person during the pandemic. However, as with everything else that's happening across the society, the face-to-face appointments have gone down to protect patients as well as the staff. For example, social distancing measures are there, so that means a waiting room that fits 40 patients can only fit 10 patients. And because of the same reasons, a lot of GPs are doing the telephone triage first, which means that at any given time, few people calling into the surgery, and then few nurses, doctors, as well as secretary, admin people are trying to call out of the surgery. So it is getting a bit more tricky and difficult.
So are you blaming the pandemic? Is it the fact that so many people are trying to get through to GPs because of COVID-19? Because surely there's not been that much of an increase in the number of people getting sick, aside from with COVID.
Well, there are many factors for it. If you look at the data that's come out, the last month's appointment figures show that there were about 5 million more appointments in March than in February, and almost 3 million more than same time 2 years ago, long before the pandemic. So the workload increase and shortages are there long before the pandemic, and only things are a bit worse. On the whole, compared to hospitals, a lot of GPs have accommodated, like they've changed their practice using video consultations as well as emailing options, and online consultations have started as well now. So they're trying to change the way they're working, but again, it's really hard to pinpoint one or two things.
So give us a bit of a steer on how the funding works, because I think you would probably argue that funding could be an issue.
It's not about funding. It is, 90% of work is done by the primary care, done in the primary care and by the GPs, and we only get 10 to 12% of the funding. Whereas if we flip it, like hospitals do about 10% funding, but they get 10% work, but they get 90% funding. GP surgeries are paid per patient, which means that unlimited consultations for and the rest of the life for entire day for everyone. So that is, I think. I mean, and also if you look at it, there is increasingly a move towards like dependence on the healthcare rather than accessing other services like pharmacy. And then there is the NHS website, which has got information about a lot of minor ailments.
So what would be your advice to anybody struggling to get an appointment with their GP?
Yeah, it is first and foremost, look at NHS Price's website. There is some information about, say, for example, mental health as well as minor ailments, what you can do. And then the next thing is to sort of approach services like pharmacy, local pharmacy. Then there's an NHS 111 website, has a lot of information and leaflets as well. If you start putting your information, like what's your problem and then your age and everything, it populates and it directs to appropriate leaflets and course of action.
Thank you very much indeed for your time. Dr. Kalinda Chimragotti, who's from the British Medical Association, had another email from the wee sassy Scottish lassie who said, let me read this to you. Thanks for tackling the problem us patients have been having with seeing a GP. Why can't they have face-to-face appointments? The vulnerable have all had their jabs, so what's the problem? Pubs and restaurants are open, businesses are back up and running, yet you can't sit face-to-face and speak to a doctor whilst wearing a mask. It's an absolute joke. We will pass on your concerns.